Unit 6, Task 10. 1. A 33-year-old salesman suffering from a duodenal ulcer. Your stomach has been producing too much acid. This has inflamed an area in your bowel. It's possible that your stressful job has aggravated the situation. This is quite a common condition and there is an effective treatment. It doesn't involve surgery. 2. A 6-year-old boy with Perth's disease, accompanied by his parents.
What's happened to your son's hip is caused by a disturbance of the blood supply to the growing bone. This causes the bone to soften. When he walks, it puts pressure on the bone and it changes shape. It's painful and he limps. This problem isn't uncommon with young boys, and if we treat it now, it won't cause any permanent damage.
3. A 21-year-old professional footballer with a torn meniscus of the right knee.
The cartilage, which is the cushioning tissue between the bones of your knee, has torn when your knee was twisting.
Right.
We need to do some further tests, an MRI scan and possibly an arthroscopy.
Sorry.
Well, that means looking into the joint with a kind of telescope. If there is torn cartilage, we can remove it then. Well, footballers often get this kind of problem, and with treatment and physio, you will be able to play again.
All right.
4. A 43-year-old teacher with fibroids.
Well, your heavy periods are caused by a condition known as fibroids. Fibroids are a type of growth in the womb. They're not related to cancer and they're quite common. When you get to the change of life, they may become smaller and cause you no trouble. But at your age, and because the bleeding has made you anemic, the best treatment is an operation.
5. An 82-year-old retired nurse suffering from dementia, accompanied by her son and daughter. Your mother is in the early stages of dementia, which is a condition of the brain in older people which causes loss of memory, particularly recent memory. Sometimes people with dementia also have delusions.
Yes.
Her personality may change. For example, she may become rude or aggressive. Her mood may become very up and down. At this stage, she can stay at home with some help, but her condition will deteriorate and she will need to go into care in the long term. 6. A 2-week-old baby with tetralogy of Fallot, accompanied by her parents.
Your baby has a heart condition which developed when she was growing in the womb. Some babies with this condition are born looking blue, but it's also possible for the blueness to develop after a few weeks. The blood flow in the heart becomes abnormal, and this causes your baby to grunt and have difficulty in feeding. Fortunately, there is an operation for this condition which is very successful. It's extremely likely your baby will go on to lead a normal life.
7. A 35-year-old receptionist suffering from hypothyroidism.
The cause of your problem is your thyroid gland, which is situated here in your neck. The hormones from this gland affect all areas of your body. If the gland isn't working properly, many things can go wrong. For example, it can cause weight gain and hair loss. This is a common condition and the treatment is simple.
Good.